Hello everyone and welcome to AceOSCE's video for today. Thank you for joining me, Alicia. And in this video, I'd like to go through how to maneuver through the CTC or the Compendium of Therapeutic Choices. There is a lot of information in each chapter in the CTC, so in this video, I'll try to aim to simplify that for you as to how you can read through it in an easier manner and try to answer a few questions that I got from other students, which may be able to help answer some questions that you may have as well. In case you have more, feel free to comment in the comment section below and I'll try to help you guys out. So this is going to be the interface, guys, for the online CTC version. Now, this is the version that we as pharmacists use because it is the easiest way to maneuver through the chapters and get the information you're looking for. Also, the online version has the most updated guidelines for treatment. So if I go back to my book of 2018, a lot of disease treatment guidelines have changed in the past few years. So I would highly recommend, in case somebody is using an older version of the CTC in a paper form or a book form, try to get the newer versions because there may be changes in treatment guidelines. Or if you're someone who's okay using the online version, this is the best way to go through because you will get the most updated information in here. There is a little bit of a difference between the online and the print version, and I'll try to highlight them in the video as well. So here is, for example, Thyroid Disorders is the chapter I'm taking for the purpose of this video. On the left, you'll see a table of contents, which you don't usually get in the paper form. But in the online form, you get a table of contents, which will give you a little breakdown about what information is stored in what index of the chapter. So the first thing that you see in any chapter is going to be the introduction, which will give you a little bit of information about the illness itself, the goals of therapy, which are important, of course, to see what is the end point of therapy, what sort of investigations we need to do in order to make sure that this is the disease or not the disease, any differential diagnosis. Then comes the non-pharmacological methods of treatment of the disease, or at least simplifying or alleviating the symptoms of the disease. And then comes the major thing, the pharmacological treatment guidelines for the disease, after which comes pregnancy and breastfeeding, drug options, therapeutic tips, algorithms, and drug tables. I'll try to go through each one for you guys. So here in Thyroid Disorders, the first thing we see is hypothyroidism, and there's a little introduction here. In the introduction, it gives you a little idea about what the chapter is about and what the disease is about, how prevalent it is, and maybe some basic lab values. Someone asked me if it is important to memorize all lab values. I would say no, not all lab values. If needed, they will be provided in the question for you. But the more common ones, such as blood pressure, diabetes, values in thyroid disorders, those are things that you are expected to know. So those ones, yes, I would advise you guys to memorize. In terms of investigations, there will be some tests. It'll show you what sort of enzymes are high in certain diseases and lower in certain diseases. So in case there's some sort of a case-based scenario, you'll be able to see if it is pointing towards a certain disease or not. It is important to memorize these things. So what tests are used for what diseases, what enzymes are elevated in certain diseases, you will be expected to know those. Also, sometimes you'll see a table. For example, here you'll see a table 1 here, which is included under investigations. It may show what are the common disease risk factors or influencing factors for a disease. You will be expected to know those as well. So do go through them very, very well. Moving on, if you see, you'll see therapeutic choices next, and usually you'll have non-pharmacological choices as the first option. So as you guys know, always non-pharmacological choices are a good idea to advise to your patient. This is going to be your pillar of strength, especially for your OSCE cases. And you would be expected to know these things even when you have some MCQ based questions or evaluating exam based questions. So the most basic things, yes, you would be expected to know about each disease, how it can non-pharmacologically be managed. However, the mainstay is going to be pharmacological therapy. So it is going to take you through different classes of medication if any disease can be treated by more than one medication. We'll give you the algorithm as to what is the best thing to treat it, and then what are the side effects of that therapy, and what if it is contraindicated, and under what conditions can a drug be used and cannot be used. So as you've understood, this is going to be the most important section in the CTC for you guys. So I used to kind of make notes, underline them, have a little algorithm in my head. If that's what helps you guys, maybe take out a print off and do that. But yes, memorizing the CTC for your MCQ is the basic thing that is expected out of you. When you start studying, yes, it'll look like too much, but everybody does it and you can too. Let's go on with the video now. After you finish your pharmacological choices, as you know, there are a lot of changes or drugs that cannot be used in pregnant and breastfeeding women. So the CTC provides you with a different section altogether for treatment of the disease during pregnancy and breastfeeding. It will give you information as to what drugs can be used and cannot be used in pregnancy and breastfeeding. And as you guys have seen and know already, this is a very important part for your MCQs or OSCEs. You should be knowing which drugs are contraindicated, which can be replaced by other medications for a certain disease for this patient population. At the end of the chapter, you will see something called therapeutic tips. A lot of people asked me if this is something you want to memorize or read through, or what do you want to do. I would usually say that you definitely want to read through that. I clearly remember when I was studying for bipolar diseases, there was a lot of information about lithium in the therapeutic tips, which came in exams, which were expected for you to know. So if you skip this part, you will not know the answers to those. So definitely read through those, they will enhance your understanding. And here is the algorithm, guys. So if you are using the online version, you'll see the algorithms as a separately named indexed piece. However, if you are going to be reading through the paper-based version, these algorithms will be anywhere within the chapter. These are going to give you a lot of information in a tabular form, which I personally find very helpful, as to how you can proceed with the treatment of a certain disease, how long you want to wait for to see the reaction, and proceed further or refer. So very important. And last but not the least, guys, at the end of each chapter, you're going to see drug tables. All the drugs mentioned as treatment options in your CTC, in your pharmacological choices, will be listed over here. There'll be a basic dosage, an adverse effects profile, a drug interaction, and comments profile. This table is very, very, very important. I cannot emphasize how important this is. There'll be a lot of important information over here, and because it's a tabular form, it is very easy to read through, and a lot of drug classes which are the same. For example, almost all beta blockers or almost all calcium blockers will usually have the same side effect profile, will have usually the same comments associated to it. So definitely read through, have review groups to review this information again and again. I hope you guys found this video helpful. I tried to answer a few questions that most people asked me. However, again, if you guys do have any other questions, feel free to comment in the comment section below and I'll try to answer them. There are some slots open for December 2023 for OSCE and EE mini mocks, so definitely reach out to us and let's keep the revision going.